Especially after a significant weight loss, having flappy arm skin can be a problem for many blokes and women out there. Learn all about a procedure that can eliminate that unflattering flab today on The Younger You.
I'm on top of the world, now I'm living, and the good just gets better, keeps on giving. Not even close to the end, it's just beginning. Life is getting lighter while the days are getting brighter, yeah. And it's a good, I won't even worry anymore. Took all my cares, still can kick them all out the door. Go on and try, come and tell me what you're waiting for. Move and keep them going till your life is overflowing, yeah.
Welcome to The Younger You. Today on the show we're talking all about a cosmetic procedure called brachioplasty. It is a procedure where excess skin is tightened and then removed to give more of that, well, what we call that Michelle Obama effect on the upper arm. First of all, I'd like to introduce you to Dr. Dunkley, our fantastic cosmetic surgeon who is performing this procedure today. Welcome to the show again.
Thank you.
All
nice
right.
to be here.
Brachioplasty, or as we call it, the Michelle Obama effect. Now, what is it?
Essentially, we're removing excess skin from the upper arm to give the arms a better contour and look.
Okay, not possible from just working out at the gym?
On the patients who choose to do this, no.
Okay.
If there's any other option, we do it because we don't like scars. We're cosmetic surgeons.
Yeah.
So we only do this if we have to.
Remember when Michelle Obama first came into the White House, there was a lot of chatter about her arms and how amazingly toned they look. Can you get that look with this type of cosmetic surgery?
You could get a really nice look. The only downside is on the inside of the arm, there'll be a mark.
This procedure is the ideal candidate for someone that has lost an excessive amount of weight.
Yeah.
Am I right on saying that?
Oh yeah. Oh yeah, the ideal candidate is somebody with a lot of excess skin, and that usually comes from a significant amount of weight loss.
Okay, a viewer question wrote in and asked you, Dr. Dunkley, are there any other procedures apart from cosmetic surgery that can be done to tighten the skin around the arms? I can answer that, get to the gym. But I'll use your professional opinion.
Well, there are many devices for skin tightening. All of them have what I call the same single downfall, and that's that they usually don't tighten as much as we really want. They all will tighten some, but we just don't get the same effect we can get with surgery and by removing a significant amount of skin. Now, that being said, there are some more less invasive procedures, like just liposuction alone. So if they don't have a lot of skin...
Oh, you can do liposuction on the arm?
Oh, absolutely.
I did not know that.
Yep, absolutely.
Okay.
Yeah, if there's not a significant amount of excess skin, we can do liposuction, and you do get some tightening as the liposuction heals.
That brings up a really good point that I think is important to discuss right now. When this viewer wrote in, and of course I have fun by saying get to the gym to tighten up the skin, skin tightening and fat removal are two different things, aren't they?
Absolutely.
And so when someone says, is there machinery out there or something out there that can tighten the skin? Yes, but of course you're removing the fat too. Talk us about the difference with that.
So anytime we remove fat, we're deflating the skin. It's like deflating a balloon. You deflate
Right.
a balloon and it doesn't go down to a hard little rubber ball like it started out. It usually is stretched out.
Yes, yeah.
And the skin...
And dimply.
And dimply, exactly. And the skin does the same thing. So when we remove fat, we're deflating the skin, and then we're kind of at the mercy of the skin, how much it's going to tighten for us. There are two things that we've come up with to help get even more skin tightening than we would get with just liposuction alone, and that's use of either the ultrasound assistance or laser assistance with the liposuction.
What do they do?
Well, the energy they generate tends to give us better skin tightening than we get from just traditional liposuction.
So post-surgery?
No, actually during the surgery. So traditional liposuction, fluid in, suck the fat out.
Yeah.
With either the ultrasound assisted or laser assisted, the fluid goes in, then we would treat with either the ultrasound probe or with the laser to either melt or break the fat molecules apart and then suck the fat out.
Viewer question wrote in and asked, will I be able to pick up my toddler son soon after this procedure?
Not soon.
I was going to say that. You're thinking more weeks rather than days.
Yeah, probably 10 days to 2 weeks before you'd be able to pick up an infant.
All right, there's some great questions. We're going to have more information on our website, Dr. Dunkley, but I took my questions to the street to find out what you thought about why someone would feel they needed to have this procedure done. Take a look.
think more so just as you age, I think a lot can develop like under your triceps and everything like that. I think it's just important just to stay healthy, because the more you age, a lot of people want to be more fit.
And slim arms, I think it's self-confidence for one. You want to be able to wear certain fashions and certain looks and feel confident about the way you look.
Yeah, like I said, no bingo arms. Like, yeah, like
What does that mean?
when you like wave your arms and there's bingo.
Oh, that's an odd question. I'm really not sure. I guess just for cosmetic or just the way they want to look, yeah.
Coming up after this short break, I have a few more questions to ask Dr. Dunkley, and then we get to meet our patient, Kathy, and see why she needed to have an arm lift.
Like us on Facebook for updates on the show and how to join the Younger You conversation.
Welcome back to the show, where we're talking all about a surgery called brachioplasty with Dr. Dunkley. Dr. Dunkley, I have another viewer's question for you. Will I need multiple procedures if I have a lot of excess skin? Or is this a one-hit wonder operation?
It should be.
I added that last part, just to let you know.
Oh, good. Thank you. Glad you clarified. Honestly, you should only need one surgery to get rid of all the excess skin. This is a procedure. The armpit's kind of a moist area. Occasionally we'll get small areas that'll open up and we'll do a little revision, but it's not really to remove excess skin. It's just to get that scar to heal up a little better.
Why am I feeling that it's really painful? I personally have a feeling that having it done on the arms is mighty painful.
Because it probably is. It hurts.
Yeah, because we're using our arms a lot.
Imagine trying to get a shirt over your head.
I couldn't.
Yeah.
I couldn't imagine that.
It hurts.
Dr. Dunkley, is this a procedure that you would commonly do when you are having another procedure?
You can definitely combine this with other procedures. We'll combine it with a tummy tuck at times, or with some breast surgery, or even with some liposuction in other areas.
Do you suggest that?
If the patient wants to have more things done, I do suggest they do multiple things at once. Our time constraint is, or our limit, I should say, to how much we can do is time. We want to make sure we keep underneath usually 5-6 hours at the absolute max for any outpatient procedure.
We're going to talk a little bit about the scarring right now. Is there anything that you can do after the procedure as a patient to reduce the scarring more than what we would be able to by doing nothing?
Yes, absolutely. There are some strategies. There's scar healing creams. Most of them have a silicone base to them. For some reason, our body responds differently when we apply silicone. There are even silicone tape strips. So they're clear, they're sticky on one side. You can put those on the scar, and those also help the redness to fade and help it to stay thinner.
Well, what about those laser machines that we all hear about that fix scarring, that fade scarring? Is that a myth?
Nope. There are definitely laser treatments that will help too. Lasers tend to help most reducing the redness in the scarring, and sometimes a little bit on the width of the scar, but mostly the redness.
All right, well, Dr. Dunkley, great information again. It's time to meet our patient, Kathy, to see why she felt she needed to have this procedure. Take a look.
My name is Kathy Torres. I'm actually here to have an arm reduction.
Hi, Kathy.
Hi, Dr. Dunkley. How are you?
I'm well. How are you this morning?
I'm good.
Excellent. Ready for your surgery?
I am ready.
All right, that's exciting. Patients start to ask about a brachioplasty when they find that their clothes aren't fitting well, or just liposuction, and then depending on how much excess skin they have, will determine what we need to do.
I'm confident now. You know, I don't question who I am. I don't think it's going to change anything that way. But it'll be nice to buy coats and shirts that aren't too small in the arms, but yet fit everywhere else.
The most common complaint when somebody comes in asking about a brachioplasty is that they just can't fit into the sleeves of the shirts they're wearing, that it's constricting and tight, and then they come in wondering what can be done.
Well, I've had a daughter who's been critically ill for about the last 8 years, and a family becomes so consumed with helping whoever it is within, the family to get well, that sometimes we forget a lot about ourselves. And my other kids were always saying, Mom, you have to take care of yourself. And I tell them, I don't have time to worry about me. And a couple of years ago, I started making some big choices, ended up losing about 90 pounds, and just want to get rid of the excess weight that's still left on my arms.
This patient has what I would consider a fairly severe case of upper arm skin excess. For mild cases, we actually don't do the full incision down the inside of the arm. We can actually do an incision that runs to the front and the back of the armpit and take out a little ellipse of skin that way and pull it in this way. That combined with some liposuction can really improve the contour of the arm.
My shoulders hurt, they bother me, and I don't know if that's related to the additional weight in my arms or not, but just look and feel better.
So we're going to do this surgery with the patient completely asleep. That means they're under a general anesthetic, which means that we're using anesthetic gases, which the patient breathes, that keeps her asleep. At the end of the surgery, she'll wake up, and it'll take a little while for those gases to come off, and she'll get more and more awake in the first hour or so after the surgery.
I do think the stereotypical plastic surgery has changed, and we're surrounded by beauty all the time, and it's been amazing to me how many people have had a little work done or have changed something that's maybe bothered them forever.
It'll be a little bit of a nuisance initially because you use your arms for everything you do. So
everything.
Yeah,
everything. I'm calm. I'm not really anxious or anything today, just excited to get it done.
After the break, we'll learn more about Kathy and why she felt she needed a brachioplasty procedure. Be sure to head over to theyoungeryou.tv to stay up to date with all things Younger You.
The following footage contains surgical procedures. It may be too graphic for some viewers.
Oh, I'm here for me. And I think my whole family will enjoy it. I know I'm a confident person, but I think they'll enjoy seeing me be just a little more confident, and I'll dare wave at somebody sort of thing instead of feel like I have to hold the bottom of my arm so I can wave.
Okay.
All right, I'm ready.
Excellent. We'll let you chat with my nurse and my anesthetist, and we'll get going.
Okay.
So the steps to do a brachioplasty involve first liposuction to remove some of the excess bulk in the upper arm. We want to make sure that we get that skin as close as possible to the muscle so they get as nice as possible contour. So liposuction is done first, and after we've sucked out as much fat as possible, then we'll remove the excess skin. Now we're doing the ultrasound portion of the liposuction. And this probe gives off ultrasound energy waves. They travel down the probe where these rings are here on the probe. It makes those waves disperse, and that helps to break the bonds between the fat. It's actually gentle enough that it doesn't destroy the fat cells themselves.
It's my turn. I really think my daughter that's fought with her health is doing well, and it's my turn to take care of me, at least for a little while.
So these are just plastic devices we put in through the skin. They have little threads on them to hold them in place.
Ooh, there's air conditioning.
And those protect the skin from the waves that are traveling down the probe. Even though they disperse primarily here, there's still energy flowing along the whole length of the probe. But we'll break the fat up right now, then we'll do some suctioning and suck it out. Once we get the skin deflated and nice and loose, then we'll cut it out, the excess skin, and go from there. We'll do liposuction circumferentially around the arm. We want to remove fat even in the areas where we won't be removing skin. And again, that's just to bring about a more favorable, nice contour.
Yes, I have had friends that have come in, one that has had work done in this clinic and one that had gone to another, and they were scared. They look great. The one thing I have noticed is it's once you correct something and see how amazing the changes can be, I've seen them add a few more things on, you know, just kind of like next. So, and that's okay too. I might be back.
There are a lot of nerves and vessels that run down the inside of the arm. So when we do this procedure, there's actually 2 layers of fat, a superficial and a deep layer. And we try to remove all the fat that we cut off, that is, all the fat that we cut off, we try and keep just to the superficial layer and leave the deep layer so that that layer is protecting the nerves and the vessels. If we stay above it, we know we can avoid those.
With all the medical ups and downs and things that we've gone through with my daughter, my family's been my entire strength, you know, and a lot of my friends as well. They've been there like family. So I don't question, you know, how much they would support me, or they just do.
The next 24 hours aren't going to be the funnest. She's going to find that she swells more. We have a system of pathways called lymphatics that drain the excess fluid that the blood vessels don't collect when they take fluid out to the extremities and nutrients. And we're going to disrupt all those lymphatic pathways, so usually you'll get pretty noticeable swelling from the elbow down to the fingers. And that's not just the first 24 hours, that's going to be for the first couple of weeks probably.
I'm excited. Unfortunately, I guess having your arms done is one of the only scars that don't ever really look like they've healed, and they can't put them in a place that they're not visible if you're in a shorter sleeved shirt or something, but that's okay.
Usually the pain is its worst for the first 4 or 5 days. Afterwards, he'll start to feel better and better each day. Contour-wise on the arm, how much smoother and smaller it is compared to what we had before. We've probably taken off at the center point 5-6 inches of skin. This is the deep layer of fat that's kind of bulging out a little bit, and we're going to just put some interrupted stitches in between these staples now to start closing up the incision.
We each have our time, and I think a lot of people that deal with family members so critically sick, you don't have that time. I hope it doesn't make me sound like I'm being selfish. It's not that. It's just, I mean, if it were one of my other daughters needing something, we'd be doing that too. It's just, we're all good right now, so I can do it.
Coming up after the break, we finally get to see Kathy's final results. Well, it's time for my favourite part of this whole process here on The Younger You. I want you to take a look at Kathy's before and after shots. Well, Kathy, congratulations. I'm so happy that you chose to be a healthier, happier you.
Me too.
Now, when I say that, by losing 90 pounds, there's a lot of less strain on the body.
Absolutely. There's many studies that show less weight equals healthier.
By having the excessive weight loss, you were left with some little floppy arms.
Some big floppy arms, for sure.
When you see your before and after shots, are you like, Dr. Dunkley, you're the best?
Absolutely. And he is. He really is.
She was actually an ideal patient. She had the extra skin, we can get it off, and usually patients with that much extra skin are willing to put up with a scar that's not pencil thin, might be a little bit wider, just because of the improvement in overall contour and function.
I was just ready to have it done. I was so tired of, trying to stretch sleeves down over my arms, and all the excessive weight and skin left over in my arms caused my shoulders to hurt all the time.
How did you get overweight to begin with?
Lots of food.
Yeah.
Really and truly.
Was there a reason?
I think we associate food with relaxation, and anytime you sit down long enough to relax, I felt like I needed to eat.
I think everyone is interested to see and hear your journey because you become inspiration. And I don't think you realise that.
That's a scary thing.
When people sit at home and watch the work that Dr. Dunkley's done on you and they go, I can lose an excessive amount of weight and there's help for me at the end of the tunnel as well. And I think that's something that you and I talk about quite a bit. Yes, we talk about the surgery, okay, but let's talk about the mental state about after that surgery.
There's no question it changes patients. I see happier patients, increased confidence, different personalities altogether when they come back after these procedures. It really makes a really positive mental impact.
Well, I've got goosebumps you saying that because I've seen Dr. Dunkley's work on season 1 and the work he's done on season 2, and it's something that our viewers are interested in. You, before this procedure, had told me off camera that you used to always try and cover up your arms.
Yes.
Why?
It was like I had 4 of them. It was 2 sets of arms, literally, is what it felt like.
Now?
Oh, it's wonderful.
You're out
It's
waving
nice.
those arms around going, look at me.
Well, I don't I'm getting there. It's wonderful. I can fold my arms. I just do so much more with them. And that's a good thing. You know,
That's a good thing.
Very good thing.
Yeah.
More active, more confident. She wants to get out and do more.
Yeah.
That's a great side effect of
My
surgery.
shoulders don't hurt so bad that I don't want to go out and do things.
Yeah.
Yeah.
It encourages you to be even healthier.
It's definitely, I mean, way different than it was before.
Yeah.
So,
huge difference,
difference.
Dr. Dunkley. Tickled pink?
He's not being totally honest.
What do you mean?
He was excited the second.
I'm like,
I have to tell
I
you.
thought you were going to scare us both
The
then.
second I walked in his office and told him what I would like to do, he lit up. He really did. And just took his pen out and started drawing, and he couldn't wait. He was more excited to do my surgery than I was.
Okay, well, that's something I wanted to ask you. When you see, and we'll say excitement, or when you see that look on Dr. Dunkley's face, for an example, did you think, I've got the right doctor?
Oh, yeah. Yeah, for sure.
Okay.
He cared. He was so excited.
All of the patients that I've seen come through this show with Dr. Dunkley, they just said his before and after care is impeccable, his bedside manner is impeccable, and
Yes.
we appreciate that
And
as
the
well.
phone calls afterward, and just always checking.
Good job. Thank you for sharing your story.
welcome.
Good luck with your
Thank you.
continued weight loss, and I'm so happy that you've chosen a healthier lifestyle as well. Congratulations. Thank you,
Thank
Dr.
you.
Dunkley.
And thank you.
After losing a significant amount of weight, excess skin can make a person feel even more unattractive than they actually did before losing all the weight. Having a procedure like brachioplasty is much deserved after all the hard work of weight loss. To feel confident about your arms, like we said, the Michelle Obama effect, perhaps brachioplasty is the right choice for you. For more information about Dr. Dunkley or Envision Cosmetic Surgery, head over to our website at theyoungeryou.tv, and I'll see you next week. We've seen many different types of facelifts over the last year. Learn about a special procedure Dr. Barson does called an encore facelift, coming up next week. So when we lift up the face, we're lifting and pulling back a little bit, aren't we?
Yes.
When we look in the mirror.
In traditional facelifts, a lot of times will pull back more, and this is where you get the wind-blown look.
I got you.
The Younger You set provided by Madison McCord Interiors.